Good afternoon, everyone. I'm Stanley Brown. I'm the Dean of the Dalla School of Public Health, and it gives me a lot of pleasure to welcome everyone here today to really what is the start of I think, really important conversation that'll be supported and facilitated and led by our Center for Global Health. But before I make a few opening remarks, I'd like to start with a land acknowledgement. And so we'd like to acknowledge the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabe, Wendat, Huron, and Haudenosaunee Indigenous peoples, on which the Dalla School of Public Health now stands. The territory was the subject of the Dish with One Spoon Wampum Belt Covenant, which was an agreement between the Iroquois Confederacy, the Confederacy of the Ojibwe, and allied nations to peaceably share and care for the resources around the Great Lakes. We'd also like to pay our respects to all our ancestors and to our present elders. So let me just put a little bit of a context around this. I think probably everyone on this webinar today has acknowledged and recognized and worked towards the importance of global health for a long time. But the COVID-19 pandemic has provided an acute reminder of how interconnected health, economic, and social issues are and continue to be. The need for increased global collaboration and cooperation to reduce the impact of both this and future epidemics, and the importance of taking a global health approach, even when thinking about our health here locally at home. So today's event, as I said, is the beginning of a conversation that the school's Center for Global Health is facilitating to help shape Canada's global health future. And we're lucky to be doing it today with a panel of distinguished experts. I won't say much more other than to say I'm really glad to see such strong participation in this. I know that everyone's time is at a premium these days. I know that everyone is probably just hankering for a few minutes off of Zoom or off of Teams or whatever sort of kind of engagement we have now electronically. But I'm glad that you're here. I'm glad that this is a conversation that's going to continue. And I'm looking forward to the day when we're going to be able to do this in person. With that, it gives me a lot of pleasure to introduce Erica Di Ruggiero, who is an associate professor with us at the school, someone who's had a long career in public and population health and in global health, and who leads our Center for Global Health and is really shaping the school's strategy in this area. With that, Erica, I'll turn it over to you to get to the really important part of the day.
Thanks so much, Stanley, and really appreciate those opening remarks. And it's my distinct pleasure to open this event and to acknowledge one of my colleagues, Dr. Gary Aslanian, who's an adjunct faculty with our school. You'll hear from him shortly when he moderates the Q&A. I just thought I'd start off with a few opening remarks just to situate this conversation. And it is one of many conversations that we're hoping to have here in Canada together with many of our partners around the world. As Stanley has underscored, the pandemic has really emphasized or re-emphasized the importance of global health. In Canada, there have been many efforts afoot to build global health research and policy capacity, together with academic institutions, NGOs, research funders. For example, recent strategic plans by several of our national funders, such as the International Development Research Center, CIHR's strategic plan, really underscore the importance of global health and equity. We, of course, know that Canada's feminist assistance policy is also another example of our country's support for promoting, in this case, gender equality. And recent plans to amalgamate two major organizations in Canada, the Canadian Coalition for Global Health Research and the Canadian Society for International Health, which will hopefully result in the revitalized Canadian Association for Global Health, pending the outcome of the final vote, which is imminent, are examples of many changes in the landscape here in Canada. I also wanted to underscore, though, that there are many challenges and also untapped potential opportunities that remain. For example, how can we better link Canada's domestic policy to its foreign policy? How can we better leverage our bilingual and multilingual and cultural diversities in Canada? And also the many calls that we've heard for reparation, reconciliation with our Indigenous peoples. So addressing these and many other challenges really does involve many sectors, including health and increased support for multilateralism, and how best to include health in foreign economic and trade arrangements. So not an challenging task. So given this shifting landscape, we thought it was really opportune to revisit and shape the global health future in Canada. And to start this conversation, I'm delighted to introduce our distinguished panel. Professor Ilona Kickbush, who will deliver a keynote address, and she'll be followed by two discussants, Dr. John Curtin and David Morrison. You've seen their bios, and so I'll keep their introductions rather brief. Just a word about the questions again. Please use the Q&A function. We'll be monitoring it throughout the presentations, and then you'll have a chance to ask your questions after the panelists give their remarks. We're also recording the event, and it'll be posted on the Dalla School of Public Health YouTube channel. And you will get a copy of that directly as a registered participant. So without further ado, it's my absolute pleasure to introduce our keynote speaker, Professor Ilona Kickbush. Ilona is actually our Center for Global Health inaugural visiting global health leader, and we've been really privileged to be able to work with her over the last several months. Professor Kickbush is the founder of the Global Health Center at the Graduate Institute in Geneva, and she has many areas of expertise, including the political determinants of health, health and all policies, and global health. She's a frequent advisor to countries on their global health strategies and is involved in German G7 and G20 health activities. I could go on, but you've all seen her bio in the promotion for this event. She will then be followed by two discussants, John Curtin, and John is a professor of political science and the director of the G7 research group and co-director of the G20 research group and a research associate of the Munk School of Global Affairs and Public Policy at the University of Toronto. And he'll be followed by David Morrison, who's been the Foreign and Defense Policy Advisor to our Prime Minister and Deputy Minister in the private Privy Council Office of the Government of Canada since January 2019. And he also holds Canada's personal representative of the Prime Minister or role as Sherpa for the G7 summit. So I think you'll really enjoy their three talks. And so I will turn things over to Ilona to kick us off. Thanks so much.
Thank you very much, Erica, and thank you, Seni. Thank you for having me here. Also, Gary, it's really a fascinating journey that we've embarked on together, and it's also great fun. I'd also like to say thanks to the distinguished commentators that have agreed to join us today, and that will make sure that I learn a lot of things as well. So one of the things we always say in global health diplomacy is good global health begins at home. And maybe we can start putting up the slides. I'm relying on Ophelia here. Yes. So I've been asked, as you know, to speak about shaping Canada's global health future, related also to my experience in helping a number of other countries develop global health strategies, in particular also Germany. And I will use that also as an example for some of the things one can consider when one tries to go down this road. If we go to the first slide, you can see, and I'm very serious about this, Canada changed my life. I joined WHO as a very young professional, as a non-medic, which was quite something at the time. And one of the first challenges I was given by Dr. Halfdan Mahler, the Director General at the time, is to develop health promotion. And so the first thing, of course, was to say who is a leader in health promotion, in domestic policy of health promotion, and it turned out to be Canada. And Canada at that point, both the government and the Canadian Public Health Association were willing to be a partner with the WHO to take this agenda forward. So first of all, I do have a very emotional relationship to Canada, and definitely the Ottawa Charter has followed me all through my life. But another point I want to make here, how important it is for the global environment and for global health to have countries that innovate at home, because those innovations make their way into global health as exemplars. And, you know, we discuss so much during COVID-19 now, for example, who has dealt well with the crises? What can we learn from it if we are willing to learn? But here you can see what really influenced us tremendously, particularly in Europe and later the whole of the WHO, is the Lalonde report on a new perspective on the health of Canadians. That really led to a rethinking, a thinking beyond health services, a thinking to prevention, a thinking then to health promotion, and as we moved on, to think much more about the determinants of health. So we say good global health begins at home, and this interface between the innovation at home, the global system, the common learning, and then the willingness to share, like host such a conference, you can really make a tremendous difference. So that also gives an indication that there are many dimensions to global health. Too many colleagues always see global health as health in developing countries. No, global health is about how we all work together, how we all are responsible, and how we all support each other. Like we say now, no one is safe until all are safe. Now, the Ottawa Charter was quite a while ago in 1986. I tried on the web to find a photograph of myself at the time. I wasn't successful. Maybe somebody else can do that and you can compare. But where we are now is, of course, a totally new world. And one of the ways countries have started to discuss that, science has started to discuss that, is to say that, you know, we live in a world that is really defined by humans, and they call it the Anthropocene. And so we are faced with the fact that in this new context, we also need to redefine global health and, of course, the many factors that influence our health. And therefore, there have been many new words that have also entered our language. One Health, planetary health, for example, in trying to put together the challenges of the climate and what we face as humans. Obviously, the interface also of that with other health issues, last not least the pandemic crises, but of course there would be a lot of NCD issues we could also discuss here, but also very, very much in the forefront, and Erica already alluded to it, the equity crises. And of course, the pandemic right now has increased that inequity between countries and within countries, and is an absolutely driving force right now for how we see global health. And therefore, when we discuss global health at this point, and I will also make some other additional comments on that, we need to accept that, you know, we're not building back, and we're also not building back better. We need to build forward with a totally new mind frame. And there for me is an analogy also to the Ottawa Charter, where we developed a new mind frame. And one of the fantastic things, of course, would be if Canada, with the things it also does at home, and the many research institutions you have in this area, were also to contribute again to this new mind frame that we need for global health. Of course, there are some things that have already begun in terms of that rethinking. And one of them is, of course, this, which I also wear here, the SDGs challenge, how we can work together with the goal for 2030. But of course, we all know now since COVID-19 that we already had problems reaching some of these goals, and obviously all of them impact on health. But now with COVID-19, most of the health goals are endangered, and definitely the equity goals are endangered. That's why there is much more discussion, even though that discussion also happened 10, 20, 30 years ago about global public goods. There is a new drive to discuss global public goods. And of course, there is a critical issue now around global public goods, and that is the access to vaccines. And I think for all countries, and also for Canada, the approach to vaccine equity globally will be a defining moment. It's the defining and the distinguishing global health issue in 2021, and it will be a defining issue for the level of trust that developing nations give to other parts of the world, whether they have been part of making this global public good available or not. I said I'd like to raise some other issues around global health, and I'll just touch on them very, very briefly, what I call defining contextual issues for really, really big things. There are enormous geopolitical shifts, and there is the question who will lead. In global health, we always hear, and to some extent we hear it again now, that your neighbor next door is, saying American leadership will change global health. We did tremendously miss the Americans the last 4 years. And one of the reasons we are in this crisis is because the Trump administration moved out of the multilateral system. But the question who will lead is different. First of all, it's a question of other countries coming to the fore, and we see this particularly with India in terms of geopolitics of vaccines. I've already mentioned the question who is trusted. And again, I underline that I think vaccine equity relates to that, but not only in terms of countries, it also is in terms of the pharmaceutical industry, maybe also other industries related to that. How much can they be trusted to ensure health? Then, of course, the COVID consequences, the question, what kind of political system has been better at dealing with the crises, has been better at solidarity, who is competent? And some of you might have read what's happening in Germany right now. We have a major, major government crisis because we have not been able to deal with the third wave. So it's also a question of autocracies and democracies. And those are issues that will play out in the international arena. And then, of course, and I hope and I guess we are all engaged in this, there is the decolonizing issue. Who has a voice? Erica, you also mentioned it in relation to the First Nations in Canada. This, of course, is also the case in a range of other countries. I worked a lot in Australia, and there are enormous issues to be resolved. But there are also these other forms of decolonizing, make that global health is a field only for white professors, for male professors, for that doesn't hear the voice of the many others that are engaged and that have to live with the consequences of global health interventions or the lack of global health interventions. So if we move along the lines of global health, we always have to ask those 4 questions. Who will lead in what style? Who is trusted? Who is competent? And who has a voice? And therefore, the consequences for global health and health diplomacy are that we need to be aware, as one crafts a strategy, that there is a new type of geopolitical global health that is underway, that some countries are playing better than others or exploiting better than others, that we're going to move or need to move, if we take global public good seriously, beyond development aid. We'll be talking billions, not millions, and both John and David, I'm sure, will refer to that as the G7 and the G20 have to look at financial contributions of a totally new type in response to the crises. And in this context, again, the increasing relevance of these clubs, the groupings of the like-minded. We've just seen a new one emerge around, the Indo-Pacific, etc. So we're going to see health play a much greater role in all that context. So in order to prepare for this presentation, I went off and I talked to a range of Canadian colleagues, experts in global health, some of whom I knew, some of whom I didn't know. And I want to share a little bit with you what they told me about, the strengths that Canada brings, if I can say, to the global health table, or where do the Canadian experts see gaps and weaknesses. And I will come back to some of them. I've consciously then in my following slides not grouped them as strengths and weaknesses, but try to find a slightly different, I hope more productive grouping. But definitely one thing that came, or two things that came up as weaknesses again and again. People called it the lack of steam. They wanted to see someone pushing this global health agenda forward, and the lack of policy coherence, which is obviously something we experience everywhere in every single country in global health. So if we go to this notion of how can one build on strengths if one wants to be a player in the global health arena, we're seeing, particularly in the period that Trump moved out, that the middle powers, as we call them in political science, started to organize themselves and said, how can we, maybe as a club of democracies, maybe as a regional group, etc., come together and strengthen global health. And Canada, in that kind of notion of middle powers contributing seriously, sort of 4 or 5 things came to the fore. One was, of course, the whole gender focus, from the feminist foreign policy to the follow through on the MCH agenda, but still people felt, hey, we could be doing more. Then, of course, the enormous research strength that Canada has in all kinds of global health research, and also basic science and research, vaccine research and other things. And this contribution to global health innovation, not just in content, but also in how one does it. The process of the grand challenges, for example. Then some of the experts felt there was an enormous opportunity to contribute together with others. Think of, the European Union attempting a Green Deal around green recovery, climate change, and particularly a One Health agenda. There was a feeling there is a strong NGO community. It could still, gather more steam, as I said. And what was very noticeable is that there is partly a different global health thinking in French-speaking Canada than there is in English-speaking Canada. And I think it would be worth to explore that a bit more. And the Francophone colleagues spoke a lot about the opportunities Canada has in the context of La Francophonie to take global health agendas forward with those colleagues. But, and that is also a point that really needs to be taken seriously, and it's illustrated on my next slide, that, there are discussions around the good global citizen approach. And I just took 2, 3 examples here that of course, Canadian overseas development aid is much respected, but you can see if you look at the OECD figures, it's probably not where it could be. And one can then, see that in percentages, in grant equivalents, etc. And a number of colleagues said, my God, if there's an example that Canada should set itself, it should be Norway. Why can't Canada act like Norway? And I leave that question to you, and those figures that you can see. You can see, Canada is sort of on this top half, which is not as good as it could perhaps be. Even New Zealand's better, and it's much smaller. So the other thing, of course, is that there is around, global public goods and equity. You can see those figures around vaccines and possible, vaccine nationalism or distribution. Here, Canada is right on top. People tell me it's, you could, at least if the orders you've put in come to bear, it would be, you could immunize the population 7 times over. You are part of COVAX, no question. But still, if you look at other countries and developing poorer countries looking at this, they will probably also say, Canada could do a bit more. On the other hand, it's been a very interesting to look, and I'm sorry, the next picture is, oh, yes, no, we're not there yet. We're here. Yes, we're thinking forward. Some other input from my conversations. Most of the people I spoke to said, what Canada should do is to do a fundamental reset and vision shaping. And those are not my words. Those are the words of the people I spoke to. And they highlighted a number of things that one might take into account if one moves forward, to think about, what is our understanding of global health? Many of the colleagues thought it was still too narrow. I've already mentioned, related much more to Canada's position in the world and where it can really make a difference also in terms of multilateralism, and what is coming increasingly to the fore, how do democracies use and apply global health to give the democratic message in the world. Most of the experts thought, do a few things well. And the things they suggested were incredibly value-based. The sexual and reproductive health agenda, I've mentioned the democracy agenda, the gender agenda, and also an agenda where one would have a responsibility at home and abroad, the Indigenous agenda. And that, of course, is a support for what I've called the decolonization agenda. And as an immigrant nation on the one hand, and also as La Francophonie with West Africa, the Caribbean could be mentioned here, and others. Invest even more in science and innovation is what many of the colleagues said, and champion equity in a sustained and predictable way, something Canada has always sort of stood for, also as a welfare state, a North American welfare state. But that brand, Canada, in quotes that one colleague called it, could really be equity along those many dimensions. And of course, the critical thing is, it would need a strong political commitment from the top, very explicitly, which is why I thought, why not look at some of the guys? So here, you have them, and I thank John Curtin for drawing my attention to some of these things. Here you have, 4 prime ministers, and actually, in one way or the other, all of them have contributed something significant to global health. Here in the G7 context, I'm not going to go through all of it, but also they have, in some cases, related the global and the national agenda. I remember how excited we all were when, after SARS, the Public Health Agency of Canada was created. And again, it was a model that a number of countries looked at. And, when we were trying to strengthen the Robert Koch Institute in Germany, we said, let's look at the Public Health Agency of Canada. What can we learn there? So again, these national models can be incredibly important. And of course, everyone is looking to Justin Trudeau to be this advocate for the feminist agenda all throughout foreign policy, development policy, and global health. And And one thing John told me, which I didn't know, and I'm sure he'll come back to, is that Canada is actually number one in compliance to health commitments of the G7 and G20. And maybe he's going to say more of that. And I wonder the next time I give this talk, maybe in 10 years, maybe there's a woman over there somewhere as well. So we can see that. So just a short glance at some strategies one could be using. As I said, many of the experts said we need a meaningful vision, we need political ambition, and we need political coherence. And the majority of the people I spoke to said a global health strategy would be helpful to help take the Canadian positions and contributions to global health forward. What you see on the right-hand side is the cover page of the German global health strategy. It's also available in English, as the title here says. We put the English copy on the slide. And I'd just like to very, very briefly, to stick to my time, give you 6 dimensions that I think could be helpful. The first is to clearly ask the question, how can a global health strategy, a Canadian global health strategy, make a difference? This is what we did in Germany. I'm not going to go through all of it. You can study it later. But we said, there need to be principles that Germany stands for in foreign policy, in, just how it does things in the international world. We said, where are we good at? What can we contribute? And of course, Germany is one of the oldest health systems, security systems. So that was an issue. Where have we got expertise? What contribution can we make in specific areas? For example, for all the Centers for Disease Control globally to work together, which is something that the Robert Koch Institute is very involved in. And who can be partners that we also bring to the table, in this case, like the European Union. So a starting point is really, where can we, if we have a global health strategy, where can we really contribute something? Where can we make a difference? And a lot of that difference, as you can see, is things we have done well at home. And also then, and things we really stand for, our values. The second point is to get the process clear. And this is what we did in Germany. Each country is different, but first of all, have a stakeholder process. We had young people, women, NGOs, the private sector, academia, I think it was those 5 constituencies, come together and write input papers for the strategy. And we had 2-3 meetings bringing everyone together. This group also, or these groups, I should say, presented to the International Advisory Board that I had the honor to chair, because the minister said, if we do a global health strategy, we've got to discuss this with the world. We need input from the world to that strategy. And you can see on the website some of the extraordinary people that agreed to serve. Then, of course, ministerial consultations. The way Germany does that, it goes to each ministry, they give their input, it comes back and forth and everything. And finally, the adoption in cabinet. So it's a cabinet, it's a whole of government process. And of course, this process in itself creates an enormous dynamics that can actually strengthen global health as one goes along. Now in Germany, we're in a position that people are competing who does more global health and better global health and things like that. And, despite the lack of coherence, it's something that's actually quite nice if they're competing on that. Third is to get the focus right. And if we go to the next slide, you can just see the focus areas that Germany decided on. I'm not going to go through them, but you can see in the end, they probably also wouldn't be, that enormously different for any country, but then very specific things are part of the strategy. The fourth is, the link to aspirations. And you'll remember the experts said, be ambitious as you move forward. And also the International Advisory Board, the International Advisory Board said to the Germans, be ambitious. And so it was important to say, link it to political aspirations. And so, of course, for Germany, the role in the G7 and the G20 is important, the role in the WHO and the role in the European Union. And, for Canada, that might be a different interface of roles of, North American linkages, South American linkages. I mentioned the Caribbean already, etc. But that's political influence, political aspirations. And then the last 2 points very quickly. One is then, what I call to reflect continuously. We said, what are key global health diplomacy issues that need to be addressed now? You can see one of them is strengthening WHO very clearly. Another is climate action. Right now, it's also, a shift to a pandemic treaty, for example. But, we did the strategy. The strategy was adopted in October. COVID came. And one is now thinking, what are the things that the strategy, meaning has to have enough flexibility also to take up new issues. And the last point I'd like to do on Germany is, I mentioned this dynamics, how can, what happened? We were always very proud to say, we have Angela Merkel supporting global health. We have, a range of ministers supporting global health, but that can change. We have elections also in September. We have a political crisis now. So it's important as one moves forward to create as many networks, institutions, etc., as possible. And I just want to highlight one or two here. We created a global health hub where people who are interested and committed to global health can talk, can exchange. All this is virtual now. We still have the chancellor, fully committed. But what we have now is a committee, all-party committee in Parliament, and we have regular Parliament discussions on global health. I think we've had 5 already. Extraordinary. They come through, question time and through all kinds of things. And so this has really been a very, very important thing. And you can see what Germany is trying to do. It tries to contribute financially. You can see after the US, it's the second largest donor for COVAX. But on the other hand, it wants to contribute politically. So it's one of the strongest supporters politically also of the WHO. So create that dynamics for influence and growth. So I'll end with 2-3 suggestions in terms of Canada. If one wants to move forward, I think, one also needs to recognize tensions and national interests and difficulties. The experts related to the WTO negotiations, they mentioned, of course, the mining industry. They mentioned the relationship to the United States, which is not always tension-free. So, there are those kind of things one also has to face head on. And the analyses of geopolitics, the cross-party agreements, which I mentioned with the parliamentary group that we have. This clear focus came up regularly. And I think really, really showing in this day and age, this is not just development policy, as important as it is. We need global health domestically. If we don't do global health, we're going to have a problem at home. So I just took a suggestion to develop some focus areas just for the fun of it and to throw it out. I picked up the issue about values and fundamental principles, and you recognize some of the things there: the multilateralism, the equity agenda, the decolonization agenda, the contribution to global public goods. And I think it's not only the health arena here. I think Canada plays a role in a number of the financial institutions that are now challenged in the COVAX response and the aftermath to COVAX. It could be an incredibly important global public goods voice, debt relief voice, etc. in that context. Then build health-related geopolitical alliances. I've already mentioned that with La Francophonie, with the Caribbean, and the role in the G7 and the G20. And then, this setting agendas together, this learning together, that is to say, if mental health is really important for Canada at home, let's build an international alliance around mental health, that we learn from others, that we contribute our experience. And I've already highlighted, of course, the Indigenous peoples. And I've tried to reflect some of that also with the pictures here. This diversity that Canada represents, and that should also be represented internationally. A number of colleagues kept coming back to the point, Canada, with all the issues around Indigenous people, at least, it was never a country that had colonies abroad. And that, to some extent, particularly within the Francophonie, that could be an issue that generates more trust. And I'll end with the point that I had indicated: build strong domestic structures. And that is, political coherence, coordination mechanisms, accountability mechanisms, learning networks, strong science, independent advisory and steering committees. And you have some of that in the bodies you have now, but that could be strengthened, and integrate the global health in domestic and regional agendas. So to end with the same picture that I started with: no one is safe until everyone is safe. We're all in this together. And if we realize that good global health begins at home, what we do at home makes a difference, and what we do abroad makes a difference for our health at home. Thank you very much for this opportunity.
Thank you so much, Ilona, for that thought-provoking address. I think you've given us a lot of food for thought. So I'm going to turn things over to John and David now to comment. John, mute. Can you take yourself off mute? Okay, thanks.
Okay, I'm alive and well now, I hope. I'd like to take at least a few of Ilona's excellent points and principles and apply them to the task of designing and delivering a global health strategy for Canada. In my 5 minutes, I'd like to emphasize 5 points. The first, Canadians first, or as Ilona put it, good global health begins at home. And by Canadians first, I do mean all human beings currently in Canada, whether they are Canadian citizens or consider themselves to be Canadians or not, and the big chunk, as Ilona properly emphasized, Indigenous peoples, but there's more. It also includes the many millions of Canadian citizens actually living abroad, and I would add their families too. And the principle should be that they should have the same access to a vaccine or affordable healthcare as Canadian citizens living in Canada do. And that may look like a stretch, but this we can do. It also means, I think, that we should focus on the diseases that actually kill the Canadians most. And here, I'm sure we could always count on our politicians to respond to the latest infectious outbreak disease, as they did in that horrible spring of 2003 when our fellow Torontonians, 44 of them, started dropping dead of a coronavirus that flew in from China. But over the past years, the big NCDs have killed far more Canadians than COVID-19 has done. And if you just say the words heart and stroke, cancer, diabetes, chronic respiratory, every Canadian I've ever met knows what those words mean when you start talking about zoonoses. So their eyes kind of glaze over. So I think there would be public support. And I would add road accidents, it's high on the list, but then very much mental health. And I think Lana has properly stressed that. So these are the diseases, the health harms I would start with. And of course, there's no single shot jab, no silver bullet. It really does require a whole of government, whole of society approach, and it must be led by Prime Minister Trudeau and not the Minister of Health. So it does begin at the top. The third point I'd like to add, and perhaps give more emphasis to than Alona did, is climate change. We know climate change harms health. We know the Prime Minister, since he first came into office, in the mandate letters to all his ministers, not only emphasized gender equality, yes, Indigenous reconciliation, yes, but climate change too, but he didn't connect it with health. Neither do those who are responsible globally for delivering the global summits or the annual ministerial meetings to control climate change. In fact, even here in Canada, we know climate change causes global warming and extreme heat, but we don't even know in our federal government how many Canadians actually die each year of heat. So there's a big data gap, I think, a gap at home that we need to fill to help contributing to the important work abroad. My fourth point is nature-based solutions. And here we know that nature helps health in so many ways, which I don't have time to or need to detail. And here, if you think of nature, Canada is not a mere middle power, nor even a systemically significant state, to quote the Right Honorable Paul Martin. It is a superpower in many ways. Forests, peat. So I think we need to mobilize our power at home, our global superpower status in nature, to bring it in to our health strategy abroad. Which does take me finally, and thank you for the extra time, to the group of 7. And here, let me just end with 3 suggestions, which my close look at G7 over many years draws me towards. Not only is Canada first in actually putting into practice what it puts on paper in these summit communiques, but closely behind are the UK, which hosts this year, and the United States with Biden now back. So I think we can afford to be ambitious looking ahead to the next G7 summit in Cornwall in June. So the 3 things to do there, I would respectfully suggest to David. The first is put mental health on the agenda in a very ambitious way with real action. We did a good job at Charlevoix the last time we hosted, and I think the need and the understanding is even much better now. Secondly, I'll put nature on the agenda, where the G7 has been largely silent over the years. Grow trees, protect peat is where I would start. And following that agenda, why not ask Boris Johnson to invite, as a guest international organization, to his summit, the head of the Secretariat of UN Biodiversity, who lives and works in Prime Minister Trudeau's hometown of Montreal. And finally, mobilize money for the WHO. Canada should give each year at least as much as the Rotary Club does. At home in Canada, we don't rely on voluntary contributions from Canadians or NGOs to give 80% of the money which Health Canada and PHAC spend each year. So why should we do that abroad? Why can't we give as much on a per capita basis as, say, the United Kingdom does? So there.
Okay, you want me to just jump in, Erica? Okay, thanks. And thanks to everyone. We're over time, so I'm just going to try to make 3 points. I'm going to try and take us up a little bit into the international context within which Canada would need to be designing a strategy. And Ilona would know, as everyone else does, this isn't on the agenda now, but I think that the past history of how Canada has done health, including MNCH and so on, shows that the governments are responsive to pressure and suggestions and so on. And so I would encourage the global health professionals here to give that serious consideration. Anyhow, on the wider context, I want to make 3 points. One is a downer, the next is an upper, and the final one I will let you guys decide. So on the downer, I would say that the international community and the G7 in particular has not covered itself in glory in terms of its response to the pandemic and the other challenges that the world is facing. Ilona had a great kind of triad of pandemic crisis, equity crisis, and climate crisis. That is, I think, partly a function of the leadership. The G20 was under US leadership last year, and the G7 was under US leadership, and then America First approach, which is sort of dissonant. And the G20 was under Saudi leadership. So that's just the luck of the draw. We're, I think, as an international community facing problems that spill across borders, luckier this year because we have a very activist UK presidency for the G7 and a very activist Italian presidency for the G20. So the environment will be better. And this gets to my kind of upper point. And here, the data that Ilona presented on ODA is absolutely correct. That's where Canada sits on the league table. But I would point out that in terms of the ACT Accelerator, which has been the kind of overall framework for access to vaccines and therapeutics and the stuff that's needed to put this pandemic behind us, Canada is the 4th largest donor. The US has now come in under Biden, but in terms of billions, not millions, we have put well over $1 billion into the ACT Accelerator. In terms of the equity agenda, when the world gets in trouble, the World Bank and the IMF are on the front lines, particularly for those countries that don't have the fiscal firepower that we do. We put another $1 billion into an IMF facility that well over 50 countries have drawn upon. So I think all Canadians could be proud of how we have stepped up in this crisis. It's there's a lot of work that remains to be done. The Prime Minister has said that once we have the pandemic under control at home, we will use some of those extra doses we have to do the right thing via COVAX, where we're also a major supplier for countries that are seeking equitable access to the vaccine. So I think, overall, while 2020 was not a great year internationally, 2021 will show many of the institutions functioning well. Some dates to keep in mind that will play into the health issues, the climate issues, and the equity issues. 29th of March, this coming week, the Prime Minister will chair for the third time a broad UN process looking at how to make the financing of the response to the crisis more fair for developing countries. He'll do that together with the UN Secretary General and the Prime Minister of Jamaica. Next big date is 22nd of April, which is when everyone will participate. The major emitters will participate in a climate change summit that the US is hosting. Global Health Summit on the 21st or 22nd of May under the chairmanship of Italy, G20 chair, and the EU. And finally, the G7 summit, which, as John has just said, in Corbis Bay, I think will be a landmark summit because of the ambition that Britain has brought to it. So that's my kind of upper point. The one that I want to leave you with is actually flagged. It's a geopolitical point that is flagged in the interim report of the independent panel by Helen Clark and Ellen Sirleaf Johnson, which is simply to say that the overarching geopolitical context in which the world finds itself right now is not propitious to international cooperation on health. I wish it were different. It was particularly bad under President Trump. I think the jury's out on how things will go under President Biden. This is why the meetings last week in Anchorage, Alaska, the first touchdown between the Americans and the Chinese were so important. There will be a geopolitical narrative playing out in the background for the next couple of decades, I think, that will be China on one side and the US or the West on the other. And that will shape the operating environment in which much of what has been talked about so far will happen or not happen. And it will be a relationship of rivalry between China and the West. It's unclear whether that will be healthy rivalry or unhealthy rivalry, and it depends upon the choices made by both sides. The three areas, and this is where I'll leave you, the three areas where we desperately do need to collaborate are climate, health, and the macroeconomy. So macroeconomy is slightly different than some of the equity questions that were being raised, but it certainly starts there. So I will leave it there because I think we still might have a little bit of time for questions. Thanks.
Great, thanks. I've been looking at the questions here. I'll try to ask the top three and maybe you can see who wants to jump in. So there is a comment about, and maybe John, this is something for you, that we've tried to do a lot of prep for strategy, but we never actually had one. Where is it that it stops and it never goes beyond that? There's a question on the role of young people and or those who are students or new graduates in global health, what the role they play and or could contribute, and youth as well. and whether or not youth should be more engaged in this kind of processes shaping Canada's future. And there's a question on the role of cities versus nations and players. So whoever wants to, maybe John, you can take the first one, or David, would you like to take the first one?
I'd like John to take the first one.
Right.
Happy to start, David. You can confirm and correct as appropriate. Youth. I believe the Prime Minister of Canada, the last time I looked, is the only leader at Carbis Bay, the G7 Plus Summit, who has, since he became the leader, has simultaneously had the portfolio of Minister of Youth. So his colleagues are used to him, promoting the youth dimension of it, which for the climatologist instantly translates into, thank you, Go Harlem, Brundtland, into intergenerational equity in the ecological sphere, but in many others. Invest in, participate in the Youth 7. It's one of the engagement groups. The Brits don't have very many this year, but it's one of the more visibly influential, because political leaders like to be seen surrounded by young people. And so that's our best shot at the moment. Cities, the Italians, here we move to the G20, but the Italians have put cities on the agenda in an important way. And if we look certainly in the G20, one of the engagement groups, the Urban 20, is among the more influential, and it's overwhelmingly focused on climate change more broadly. And I'll end here, if I may be allowed a commercial, in the University 7, another G7 engagement group. The president of the University of Toronto shares the lead responsibility for ecological sustainability. So there are places closer to home on which we can build.
Okay, maybe David or Ilona, you have any comment on any of the three main areas of questions? David, do you have anything?
Okay.
And then no, Ilona, any from the experience from Germany you presented, cities and their role, or the role of youth?
Well, youth, we involved in the German strategic process, and they're also very active, also because there is not yet enough academic programs in global health for young people in Germany. So the interest is enormous, and they're pushing for these academic infrastructures at home. And also it's the young people that are pushing for the climate agenda, for the planetary health agenda in particular, and are pushing for the decolonization agenda. And also, I'm happy to say a lot of young women involved. So we're seeing more diversity and gender equity here as well. So on cities, I do think, I started the Healthy Cities program a couple of decades ago. I think cities are slowly coming into their own in terms of what they have to offer, in terms of some of the solutions. We're working with donut cities using the donut economy model. There's a lot going on, and they are being involved more and more also in some of these larger state-based processes. And I must say also in the pandemic work of WHO, that is starting to move forward. They are critical, and I think anything one can do to help them contribute is very, very important, because then, as we saw under the Trump years, American cities were still contributing considerably to a whole range of agendas, while the central government, had moved out of multilateral processes. So it's also a bit of an insurance policy to take certain agendas forward. On the why Canada doesn't have a global health strategy yet, I would have left that to the two Canadian colleagues, but they opted not to say it. So that's it.
Okay, it's your last chance in case you do want to say anything, but I know we've run out of time, so we're losing our attendees. Perhaps it's time to thank the presenter, Ilona. Thanks very much for that great overview and our discussions and the questions that came in. It's clear that this is only the beginning of some of the discussions, and we're committed to continue doing this as we seek different fora where we can have this similar discussions. We know a strategy of sorts to shape Canada's role is important. How we do it and how best we do it, we need to continue discussing, so that's clear, and is not short of interest if we were to look at the sheer number of people who have signed up and participated today in this discussion. So thanks again for participating, for providing your insights, and we will have this also posted on YouTube. So Erica, over to you to say goodbye as well. Yeah,
Thank
good.
you so much
Okay,
to our
thank you.
presenters
Thanks,
for
everyone.
taking the time and all our participants. Okay, take care, everyone.
Bye-bye.
Thanks.
Thank you.